Fact number 1. The vagina is not the same thing as the vulva. Vagina refers to the muscular, elastic canal that extends from your cervix to your hymen. But vulva is the combination of clitoris, urethra, the labia majora and minora, and the pubis. Fact number 2. Labias come in all shapes and sizes. Many women worry that their vulvas don't look normal, but what's normal has largely been defined by porn, which historically hasn't accurately reflected healthy women's bodies. The truth is, the labia majora and labia minora look different on all types of bodies. There are several general labia types, which is asymmetric inner or outer lips, curved outer lips, dangling outer lips, dangling or protruding inner lips, and small closed lips and small open lips. Fact number 3. Vulvas also come in all different colors. The color of your vulva may not be the same color as the rest of your skin, and for many women it's darker. Normal labia color ranges from pink to red to brown to purplish. All are totally normal. During sexual arousal, the color of your labia can temporarily deepen as blood rushes to the area. Fact number 4. Your clitoris is bigger than you might think. The clitoral complex is much more than just the small bean-shaped hotspot that sits at the apex of your labia minora. The majority of the clitoris, about 4/5 of it, is submerged in the body encircling the vagina. Fact number 5. The clitoris also has a lot in common with the penis. It has the prepuce, the glans, and the frenulum, just like the penis. While smaller in size than the penis, the clitoris actually has twice as many nerve endings. The clitoris has 8,000 nerve endings while the entire penis has just 4,000. It is the highest concentration of nerve endings in the entire human body. Fact number 6. Your hymen is not an indicator of virginity. The hymen, a thin fold of mucous membrane around the vaginal opening, has long been thought of as a sign of purity. According to the World Health Organization, there is no test including the presence of an intact hymen that can indicate whether a woman has had sex. The hymen can break in a variety of ways, like riding your bike or playing sports, and when it does, it's totally normal. Fact number 7. Not all women have vaginas and not all people with vaginas are women. Genitalia does not equal gender. Many people identify as women who are not born with vaginas, and likewise many people who identify as men do have vaginas and periods. Fact number 8. Your vagina can change in size and shape when you are turned on. It's called vaginal tenting and it's totally normal. The vagina averages around 3 to 4 inches in length. During arousal, it gets more relaxed and wider. The uterus is pulled upward, which changes the position of cervix, allowing the vagina to become longer, which ultimately is the readying of the body for intercourse. Fact number 9. Your vagina is not totally uniform. The shape shifting that can happen to your vagina is dynamic. In fact, the inner 2/3 of the vagina act differently from the outer third. Fact number 10. No two vaginas smell the same. Every woman smells slightly different because of her diet, the fabric she wears, her gland secretions, the level of hygiene, and her personal blend of internal bacteria. Your smell might change slightly and can even get a little funky after a workout or during your period. If it doesn't go back to normal after you hit the showers, or if you notice a fishy odor, talk to your doctor, as that can be a sign of infection. Fact number 11. A significant 2017 study on the female orgasm found that only 18% of women report intercourse alone is enough to climax. Most women, over 36%, reported clitoris stimulation was necessary to have an orgasm, and another 36% said that clitoral stimulation wasn't necessary for them to orgasm but made their orgasms feel better. Fact number 12. Sexual stimulation and orgasm release your body's own natural painkillers. Orgasm releases a wave of oxytocin which makes you feel happy and can also help to relieve pain associated with everything from headaches to arthritis. Now you have got a new reason not to shy away from masturbation during your cycle and period sex. Fact number 13. Before you make the shave, know that pubic hair has a job. It serves as a protective barrier to genital tissues, particularly the sensitive vaginal opening. And as well as providing a protective barrier, it also acts as a buffer against friction. Shaving can leave tiny and easily microscopic wounds on the skin, temporarily raising one's risk of infection. Hygienic waxing facilities are fine and may be better than shaving. However, be careful of waxing if you are on medications containing isotretinoin because it can cause wax to more easily burn the skin. Fact number 14. Like any body hair, everyone's pubic hair is different. Pubic hair which shows up around puberty is perfectly normal, whether it grows only on your vulva or onto your inner thighs or even lower abdomen. It can be thick or thin, curly or straight. The color also varies and may not match your other body hair, and yes, it will eventually go grey. Fact number 15. When your vagina gets wet, as known as produces vaginal lubrication, it's often tied to sexual arousal. But those two things can also occur independently. Scientists use the term arousal non-concordance to describe situations where your physical arousal and mental arousal are not aligned. For example, you might be incredibly turned on by your partner but have trouble getting physically wet, which can happen for a variety of reasons, which includes age, or on the flip side, your body may respond to an erotic stimulus that you are really not into it. Your vaginal response or wetness has nothing to do with giving consent. Fact number 16. The quality and the quantity of your cervical fluid changes throughout your cycle. It's a response to the hormonal transitions that prepare your body for ovulation. Cervical fluid starts opaque, whitish and creamy in your early follicular phase around the start of your cycle. It increases in quantity, wetness, transparency and stretchiness as you approach ovulation. Cervical fluid reaches peak characteristics of fertility around the day of ovulation, which include a wet, clear and stretchy texture. You can actually stretch it between your fingers if you want to try. You should call your doctor though if you are seeing any type of atypical characteristic in your discharge. These can often be due to infection but can also be allergic reactions even to a medication you are taking. If there is a change in texture, think chunky or foamy, a foul smell or an off color like green, head to a pro to see what's going on. If there is a burning or itching in addition to the change in discharge, those could be indicators of an infection. Fact number 17. Your vagina is perfectly pH balanced. Vaginas have an acid environment with a pH level of 4.5 which allows sperm to swim and survive once inside. If you use soap, it can interfere with the vagina's natural flora, which can upset the body's pH balance and cause yeast infections. In other words, don't use soap anywhere beyond your outermost labia, where your pubic hair grows. Fact number 18. Your vagina is self-cleaning. The lining of the vagina is made up of various glands that release fluids designed to cleanse and lubricate the vagina. Hence, doctors are strongly against the use of any kind of douche. The benefits of douching are practically nil and can be harmful. The douching, which is the rinsing of the vagina with vinegar or an antiseptic with the aid of douche bag, can increase the risk of vaginal and pelvic infection by altering the pH and ridding the vagina of important healthy bacteria. Research shows a link between douching and increasing the risk of bacterial vaginosis, pelvic inflammatory infections, and ectopic pregnancy. Fact number 19. Many women have questions about sex after birth, which is normal considering how much changes. From an anatomical perspective, the cervical opening may change slightly in appearance from a dot to more of a curve, but it is still closed and fulfills the same purpose. While vaginal tissue stretches during labor, it should return to its same size without much intervention. Fact number 20. Whether you have a vaginal birth or a C-section, doctors advise women to avoid penetration for 6 weeks after giving birth as the vagina needs that time to heal. Fact number 21. Everyone should be doing Kegel exercises, and definitely after childbirth once they have a doctor's clearance. To properly locate the muscles, a technique one of her mentors taught her: pretend that you are in an elevator and you need to pass gas but you are trying to prevent it. That way you will activate all of the muscles in the pelvic floor. Fact number 22. During a vaginal birth, tears do happen. In fact, most women who deliver this way do experience cervical tears. The good news is the vagina is good at repairing itself. Tears usually heal well by 6 weeks postpartum. Fact number 23. Ever tried to insert a tampon and felt like you are hitting a wall? It's because you are. The vaginal canal rests at an angle in your body, so rather than inserting up and in, point the direction of the tampon toward your back for easier insertion. Fact number 24. The word vagina dates back to the 17th century. In Latin, it means sheath. Fact number 24. Especially if you shave or wax your pubic hair, the occasional ingrown hair on your vulva is not something to lose sleep over. You can also get pimples and harmless cysts on your lady bits. Call your gyno when a bump doesn't go away after few days or is accompanied by itching or burning.